With Wellcome Trust, we've got a project called HAPI, which is an abbreviation for Heat Adaptation for Pregnant Women and Infants. We're working with pregnant women, antepartum women and postpartum women, and also looking at their infants. So this project is being implemented in rural Zimbabwe and Ebenchwane in South Africa. Ebenchwane is a slum sort of settlement, and in Zimbabwe it's very rural. It's going to help us to understand how heat adaptation interventions could be implemented in these different contexts. You'll know that over 50% of Africa still remains rural, but also urbanization is quite rapid in recent years. So having that understanding is going to help us to come up with interventions that are really context appropriate. In addition to pregnant women, we also have to work with their partners. Power dynamics are a real thing in our context, and ensuring that the husbands, the mothers-in-law, are equally involved is very important. But also in the rural context, for example, you want to make sure that the local authorities like chiefs are part and parcel of the project. And this will help us to come up with interventions that are community sensitive, that are feasible, acceptable, that we know communities will definitely take up. Of course, there are systematic reviews that have really pointed to the fact that heat will affect the birth outcomes, newborn outcomes, and maternal outcomes. But we haven't really tested this in situ within our context. And this project, for the first time in Southern Africa, we are implementing research, formative, and developing interventions that will respond to these outcomes. The appetite to implement what works is really huge in most African contexts, and for Zimbabwe and South Africa in particular. But what is missing is evidence on what works and what is feasible. And because we're already engaging our stakeholders across the divide, we can already see them asking, what can we start doing now? So what I would want to see as a researcher is really the evidence that we're producing to be actionable in policy and to be scaled, for interventions to be scaled. I think that's when I will breathe.